This is a somewhat important topic right now in the current scenario, as there are newer infectious diseases are coming and also old disease that we thought are in the process of elimination are now bouncing back. Okay, that is why these infectious diseases are very important, and that is why it is also important in your exams. Okay, in your exams you can expect either symptoms of some of these disease will be asked directly and what to do. You all already read how to investigate an epidemic and how to plan a preventive campaign or preventive measures, how to take it. You know all the steps. I am not asking you right now, but I hope all of you know these steps by heart. So, what kind of question you expect? There will be given some symptoms, you have to identify the specific disease and you have to write the preventive measures according to it, using the steps that you know. That okay. So, first coming to the emerging and re-emerging. Whom to tell emerging and whom not to tell emerging, and whom to tell re-emerging and whom not to tell re-emerging. Okay. Simply putting, right now if you see the Bollywood movies, okay, there is a trend of now patriotic films like Dhurandhar, Uri, also that what Hrithik Roshan film? That aeroplane, fighter. Okay. In previous, these are when we are seeing, these are from post 2014. Before that there was a trend of romantic movies, and before that there was also some patriotic type movies, but their genre was different. Some Ma Tujhe Salam, there was a Tiranga. I don't know, there was a movie named Tiranga. Okay, Border. So, these kind of patriotic films has a trend, then they got somewhat not using in the trend because this is all about business, and now again people have changed their taste and DDLJ types movies are not running now. So, they again brought back these patriotic kind of films, and in time these type of films again we will change our taste, and again DDLJ type movies will rule the box office. But do we have some mythological films also, any spy thriller film in our world? No. So, Dhurandhar was a newer genre that they tapped, and also the violence, huge blood spattering scenes, action which seems realistic. Like that, this is the concept of also emerging and re-emerging. When it is coming, a concept coming to the new in the population, we call it emerging. And when the concept or disease is again coming to the population from beforehand, it was existed, but in time these diseases prevalence were decreased and now prevalence are again increasing. Those we called as re-emerging cases or re-emerging diseases. Okay. So, obviously concept is not, there is also some bibliographical definitions. Whom to call as emerging? Those which were not experienced previously, or those with already known causative agents but not previously known to infect humans, or occurring in new regions where previously they were not existent, also occurring in new age group with new clinical features and developing resistance to existing treatment. These kinds, what the first, obviously these agents were present, but they only infected the lower vertebrae or the reptiles, not the humans. Now they have crossed the what we call microbiologist as species barrier. It crossed and coming to the human, now infecting humans, just like AIDS. AIDS was first isolated, AIDS virus was first isolated in rhesus monkeys. How it came to infect humans, we don't know. Probably evolution or something else. Also, some diseases previously known to infect other some specific regions. Suppose it African continents. Now it is also happening in the southeastern region, southeastern countries. That is also called a emerging disease on the perspective of southeastern countries. So what are the examples? First, AIDS after 1981, also Vibrio cholerae, you all know 0139 is LTOR. This was actually discovered by Indian scientists right here in our heart of West Bengal, that is Kolkata, in the All India Institute of Hygiene and Public Health. They isolated this specific species, LTOR. Also ACT, what is ACT? Artemisinin combination therapy resistant malaria, and also MDR and XDR tuberculosis. Coming to MDR and XDR, you all know if a new kind of bacterium showing XDR capabilities and infecting humans, then that is emerging. But same simple no resistance TB bacilli, if showing greater prevalence in the community, what we call it? Re-emerging. This is the simple concept, okay. And coming to the definition of re-emerging, that old disease and new threats, and previous one new disease, new threat. So what are re-emerging infecting diseases? Those are which previously controlled and efficaciously treated but have recurred in a new epidemiological setting with increased frequency and mortality, or in a more virulent form to be a significant public health problem, such as malaria and dengue. What is the reason? Due to development of resistance by the organism for the drugs or by the vectors or pesticides. Okay, so first we have to do how come they are showing the emergence. We are now focusing on the emerging diseases. So all you know, what is the epidemiological triad? What are the three corners of epidemiological triad? Agent, environment, তিনবারই জিজ্ঞেস করবো যদি না স্পষ্ট করে বলো। Okay, so what are the environmental factors? Urbanization, catastrophic events such as any kind of natural calamities or even war. As you all know that during war there is a decline in the sanitation and hygiene, so it may emerge. Also there was malnutrition which reduces the immunocompetency and it clears the pathway for a newer pathogen to infect the human, okay. And what are the other things? That is climate change. What are the host factors? Obviously nutrition, traveling. Suppose a specific virus was confined to Amazon rainforest, but one person traveled in the Amazon rainforest and got infected. he came back to his or her own country with the infection, and the infection probable has a suitable environment like Amazon rainforest. Suppose someone from Sundarban went travel to Amazon and came back with newer things, somewhat suitable environment, and the infection got spread in our country. Okay. And what are the pathogen factors? Obviously genetic change, insecticide resistance, they also live on the survival of the fittest. So, they also grow resistance in time, and obviously a major thing that we have to now know about, that is antibiotic resistance. Okay. So, infectious disease or emerging, these kind of divided into two groups. First is due to new agents and second is due to new variant of the old pathogen. These are the new agents. Those are first Ebola, Zika, Nipah, Lassa fever, tomato fever, hantavirus, and MERS, obviously MERS, SARS-CoV, and swine flu, bird flu, etc. Okay. In your part, in this chapter, one introduction has been written that in 30 years, 30 new pathogens are known to infect the humans. Okay. They also gave a list, but that list is haphazard and scattered. In my presentation, I have given you a pathogen wise list. Try to remember 2 or 3 from each type. If you have a emerging infections as a short note, you have to give example and write like that, emerging bacteria, this emerging virus, emerging fungi, emerging parasites, and also for re-emerging also I have given the another list. Okay. And what are the new variants? E. coli new variants, you all know 0139, 0139, and also there is 0157. There is also Exanthem subitum and 039. First coming to the, obviously first is in this case, if you have to write, you first have to write on AIDS. Okay. AIDS, this is already covered. So, I am coming to the next case, that is tomato fever. These tomato fever cases were seen in Kerala in 2022 in May. Okay. In children, this type of thing we saw. Okay. Why this is called tomato fever? Because the child developed blisters just looking like a tomato. Okay. You all know the blisters, how to differentiate for smallpox, chickenpox, herpetic. But these types are different from all the others. That is why they named as tomato fever. Okay. And also the causative agents were still unknown. We are yet to differentiate what is the causative agent, but obviously if it is not visible under normal microscope, probably it is a viral origin. Okay. But without specific stain, it is very difficult to identify the virus. Okay. So, what is tomato flu? Very small introduction on these diseases. It is also known as tomato fever, a viral disease that causes blisters that resemble tomatoes. It is still contested as a viral fever or an after effect of chikungunya or dengue, that is another thing. Okay. Right now we actually termed as a viral. What are the symptoms? High fever, dehydration, sneezing, joint pain, coughing, stomach cramp, severe body pain, diarrhea, rashes and skin irritation, and these kind of blisters you see. Okay. Except for this kind of rashes, all other things resembles, all the other things except for rashes resembles what? Pox. পক্স তো শুরুতেই আমি র্যাশ চলে আসছে, আমি তো বলছি এক্সেপ্ট ফর র্যাশেস all the other things resembles, okay, high fever, joint pain, coughing, stomach cramp and severe body pain, dengue, and if we add dehydration and very bony pain, what is the causative agent? Dengue to hoye gelo, chikungunya, okay. Causes still are unknown. What are the transmission that came? That obviously it's a contagious, okay, probable airborne or droplets. What are the preventive measures? If it's a contagious, we have to maintain hygiene, nothing else. And how to take? Do not, this is only symptomatic treatment and proper care and get away from others, nothing else, okay. But if questions come giving you tomato fever symptoms, you have to write using the steps, okay, that how to, the question will come such as that in your block these kind of things are seen, how will you manage it as a BOMOH, okay, or these kind of things are coming, how will you investigate? You have to write using the steps of investigation of an epidemic, but remembering these things, okay, nothing else. Then coming to a exotic disease, that is Ebola. It is given in your park as separate chapter, but now right now there is a Ebola outbreak is also going on, so it may come as, okay. What Ebola also doing? That is also doing viral hemorrhagic fever, just like dengue, okay. Initially it was detected in 1976 and there are 35 outbreaks occurred from 1976 to 2016, largest in West Africa in 2014 to 16, okay. But if now Ebola, where Ebola is occurring, not in the West Africa, sir, South Africa. What is a West African country? Probably Zimbabwe, but now it is coming in the South Africa, okay. These are the epidemiological determinants. Just remember what are the agent, Ebola virus, which is the RNA virus, what are the reservoirs, animals, which animals, monkey, gorillas, chimpanzees, and what are the natural host, fruit bat, what are the infective materials, blood and body fluids, any kind, and also fungi, that is why it is that much dangerous. What are the mode of transmission, close contact with blood or direct contact between humans. This is not important. What are the pathogenesis? It damages the blood vessel, altered the arrangement of the endothelial lining, coagulation, fluid leakage, drastic decrease in the blood pressure. Where we seen that? This is also the symptoms of dengue shock syndrome. There was excess loss of fluids which created shock. What are the symptoms? The blue ones are early stage symptoms and red ones are advanced stage. So in the early you will see only headache, fever, fatigue, muscle pain or sore throat. But if we do not suspect Ebola, what will happen then? Impaired kidney and liver, that means failure, diarrhea, vomiting, rash. In case of Ebola, rash comes later. See in the question also. Is it coming with rash, and is the rash is associated, is from the onset of fever or it is coming in the late stage? If coming on the same time, that is dengue or chikungunya or even tomato. If the victim is a child, but if rash is coming in the late stage, it has to be Ebola. Even is the scenario in India, okay. What are the treatments? No specific treatment, so we have to see on the prevention. That means vaccine. Is there any vaccine? No. That is why we are that much, nothing hand, only symptomatic treatment. So what we have precautions we can take, that are use of disposable medical equipment, sterilization, personal precaution, high standard of personal hygiene, use PPE, avoid contact with bats, non-human primates, even avoid sexual contact. And also if you are returning from the endemic area, you have to be isolated for 21 days. Remember that. These 21 days might come as MCQ. Okay. What are the period of isolation and quarantine in case of COVID and Ebola, even for yellow fever? These are very important questions for your MCQ exam. Now coming to a next, which causes a havoc in Brazil, that was Zika. Okay, this is also mosquito borne. Look, till 1952 it was known to be a disease specific to monkeys. Okay, so first case was on 1953 or 1952. The largest outbreak we see in 2015 to 16, which affected 33 countries, and this is also declared as a PHEIC. What is the full form of PHEIC? Public Health Emergency of immediate concern or international concern. International concern, sure. Yes, lock kara holo. See in the book. And obviously see here, India has recorded the biggest outbreak with more than 100 cases in October 2018 from the state of Rajasthan. Where was the tomato fever seen? Kerala. From Kerala we seen in Tamil Nadu and some southern states. Where we see Zika? In Rajasthan. Okay. This is the virus, icosahedra enveloped, that is not important. What is the transmission? Aedes mosquito, also transmitted from pregnant mother to fetus through sexual contact, hemotransfusion, organ transplants. How it spreads? This is a picture, okay. And what are the Zika affected areas mostly? That is North America. What is this part? This was if it is North America. What is this? Mexico and also other small countries. Anybody knows? And what is that? This is South America. But it originally identified in Uganda. Okay. Look, this is the distribution of Zika before 2007. India is in the green zone, that means it is a probable. What was the red zone? Africa. Where is South America? Nowhere. But in 2015 and 16, it jumped back to America and South America. The Zika virus, your life cycle, this picture is important. What is sylvatic cycle? It might ask in your MCQs. That is mosquito and monkeys. And for humans we call it as urban cycle. Okay. What are the clinical features? Incubation 3 to 14, duration of viremia 3 days. Again symptoms: headache, pale skin, rash, fever, muscle pain, arthralgia, diarrhea and red eye. This red eye, it is not seen in dengue. In dengue, what kind of eye symptom we seen? Retroorbital pain. That is a pathognomic feature. Diagnosis, obviously lab diagnosis. Prevention, protection against mosquito bites. Practice safe sex and vectoral control measure. What is the vector agent for Zika? Aedes mosquito, same as dengue. And action to take if Zika infection is suspected. Ask the patient if they have travelled to an area where ongoing Zika transmission. Record the reply, treat the patient, notify any surveillance team, and if there is a pregnant woman in general, including those who developed symptoms of Zika, should be closely monitored and managed throughout the pregnancy. This is also a picture on prevention. Okay, same as this is the picture is same for Zika and Dengue. Window screen, use insect repellent, wear light colored long sleeve shirt and trousers, using a mosquito net, and get rid of stagnant water from places where mosquitoes breed. Where Aedes mosquito breeds, sir? Stagnant water. শুধু stagnant water, পরিষ্কার জমা জল in কন্টেনারটা কি ম্যাটার করে তো? কি 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 স্যার সেটা কি হলো? Artificial container. If there is not the word artificial container, marks will be deducted. Okay. Treatment again symptomatic. Complications not important, just know that microcephaly, ventriculomegaly, GBS, intracranial calcification. Now coming to Nipah. This is also a zoonotic disease, mainly affects pigs and first recognized in Malaysia. The Nipah virus also kind of created some panic in our West Bengal. I think 2 or 3 months back, 2 people from our own community got affected, and I think one of them died also. This is not important. Transmission, just remember, what are the role of the pig? They are amplifying agents. In what are the other diseases where pig also acted as amplifying agents? Japanese encephalitis. And what are the host? Again same, fruit bats. Look, just like previous picture, India where a different type of fruit bats are seen. This is the green, and this purple is the where the specific type of fruit bat which carry the Nipah virus are seen. But these are connecting where? What is this? Do you know? Madagascar. And this part? Uttarakhand probable. And our West Bengal is coming as blue, where already some cases already happened. What are the symptoms? Again, fever, headache, drowsiness, disorientation, mental confusion. Each might lead to coma and potential death. Again, the incubation period is 5 to 14 days. And for treatment, we have no specific treatment. Primary treatment is intensive supportive care, nothing else. That is why, because these are called emerging, because we do not still have treatment for them. Even after years of research, just see for AIDS. We do not have a specific drug that, okay, this will kill the HIV virus. Okay. So, if there is no treatment, there is prevention. Again, hand hygiene, and with patients, avoid coming into close contact, cover nose and mouth, and healthcare workers need to follow strict infection control measures. Okay. Lassa fever. For that, only remember it is rodent. Okay. Other things are not needed. Now coming to all you know, that is COVID-19 pandemic. Agent was SARS-CoV-2 and it was sensitive to UV rays. Only remember that. COVID, if there is a question on emergence, you have to write on COVID, but I think COVID is already covered, na? All the pathogens, antigens, this is covered now in your class. Fine? Okay. So, when we first detected this in 2019 in Wuhan market of China. First case in India reported on 30 January 20 in Kerala. This was the example I given for you. What are the difference between in your question? Semester, there was one question, index case and question মনে আছে কারো? Index case and what was the question? Question মনে থাকলে তবে তো উত্তর বের হবে। Question ই মনে নেই কাজে, these were the specific, the first case we do not know, but in India who was the first case we all know. Okay, that was the index case. Probably some famous singer also was got affected with coronavirus. Okay, lockdown, you all know, that was from 22 or 23rd March of 2020. That was the first lockdown, and second lockdown was 21. In India, COVID-19, as of 12 April 2021, what are the active cases? 8.88%, discharged 90, death only 1.26. Further data are not available because those data were sealed. Okay, we do not know the actual data on COVID. That's a debatable thing. In a snapshot, what are the symptoms? Cough, fever, pneumonia, shortness of breath. What are the mitigation method? That means, what is the meaning of mitigation? Disaster পড়ানো হয়েছে তো। What is the meaning of mitigation? How to prepare for the next attack. So, use face mask, hand hygiene, use disinfectant, travel restriction, and obviously social distancing. Prevention, again, hand hygiene, distancing, and there are ban on outside beverages and outside travel. Simple. Now, swine flu. Swine flu is emerging. Why? Because every time a newer influenza agent comes to light. Okay, and what are the reason? Antigenic and shift. What is drift and what is shift? Hello, what is the antigenic shift and drift? কি অবস্থা? হ্যাঁ বলো, একটা এপিডেমিক করে আরেকটা চেঞ্জটা কোথায় হয়, চেঞ্জটা কোন লেভেলে? Oh, what are the problem statements? The World Health Organization declared H1N1 pandemic on June 11, 2009, and in India 2015, 10,000 cases of swine flu influenza were reported with 774 deaths. What is the then case fatality rate? If we took it as a 800, 774 is almost equal to 800. In 10,000 case, 800 death. What is the case fatality rate? At least whom to divide with which, এটা একটু বলো, কে উপরে থাকবে কে নিচে থাকবে, which is the denominator and what is the numerator? হ্যাঁ 8 তাই দাঁড়াচ্ছে বোধহয়, তাই তো 8/10. What are the symptoms again? Fever, nausea, fatigue, diarrhea, chills and headache. These are confusing, obviously, that is why I put all together. What is the prevention? Avoid close contact, stay home when you are sick, cover your mouth, clean your hand, and avoid touching your eye, nose and mouth. What it might cause? Why I am advised to avoid my own nose or eye or mouth? Reinfection. Okay. Then bird flu. It causes, one advantage for myself, the price of chicken got drastically down. One day it was in when I was reading high school, studying in high school, it was 120 per kilo. Next day 30 rupee per kilo. I was ecstatic. Oh yes. What are the chances that it will affect me? That is the bird flu. Okay. What are the strains that are responsible? H5N1 and swine flu H1N1. Remember that. What is H stands for? N for neuraminidase, H for hemagglutinin. Everyone agreed? Agreed, I think. H7N9 and H9N2. What are the symptoms of avian flu or bird flu? Again, fever, headache, runny nose, sore throat, muscle ache, shortness of breath, ARDS and diarrhea and joint pain. The disease transmitted to humans through direct contact with an infected bird's nasal secretion, feces or secretion from the mouth or eyes. Okay. That is why if we cook it very beautifully, all the viruses are gone. That is why I was ecstatic. Okay. So, today everyday chicken. So, emerging diseases list is completed at least. There are still cases of monkeypox which also seen in 2022 in Kerala, and obviously right now in USA hantavirus. What is hantavirus doing? Anybody read the newspaper at least? Respiratory. Yes, correct. Pulmonary syndrome. Hantavirus causes pulmonary syndrome. So, what will be the main symptom? If my pulmonary system is affected, breathlessness, shortness of breath, nothing else. And monkeypox, you all know this is a pox, so it will create what? Monkeypox will create. Any pox virus, what will create? Fever, obviously. A fever with rashes. Okay. Huh? Or pain probably or not. Okay. Monkeypox cases are sporadic and very less case reports are available. Okay. So, a complete list of symptoms it's still yet to create. Okay. Now coming to the re-emerging diseases. What are the re-emerging disease? Malaria, dengue. Years after years we are seeing the same cases of malaria and dengue. These are the most useful example of re-emerging infectious disease in our current scenario of India. Okay. And obviously now we also see Kala Jor and plague. In Maharashtra there was a cases of or epidemic of plague in 1997. Okay, many people died. Even there was a mass exodus from the entire Bombay town and Maharashtra. Then the again that was pneumatic plague. Again bubonic plague was seen in Gujarat just after 1 year. Remember that. There was a mass exodus from the Maharashtra on this plague. Okay. We all know Black Death. That was the year 1720. Sorry, 1820 probably. 1820 there was Black Death. The huge population of all over the Europe got killed over plague. Okay. Spanish flu 1920. That was also a pandemic. And 2020 there was COVID. Every 100 years there was a sweeping program from the nature itself to reduce the human load. Okay. So, what kind of public health action you can take? Obviously, what kind of public health action you can take for these emerging and re-emerging diseases? Obviously, create a proper surveillance system. Then complying with IHR. IHR I will take a class in your next coming weeks, that is International Health Regulation. it came in your previous year's final exam, okay. That is why it is not that much important this year, but part of IHR is obviously building public health capacity to train people on these kind of things, because these treatments and how to prevent, these are not written in your medicine textbook, okay. It is not written in your Harrison textbook. So what to do? We have to prevent, and for prevention you need public health specialists who can prevent the spread of the disease. And obviously those who, they also can conduct the research, biomedical research on these kind of diseases, okay. And obviously information sharing and partnership with GOARN. This is an important short note for your coming exam, okay. If IHR came last year, this year GOARN might come. So what is GOARN? This is a global outbreak alert and response system, okay, created by WHO. What are their functions? In simple word, they are in charge of monitoring the health situation of all the countries, and if there is any outbreak, they are the one who will send representative to collect the sample, identify the pathogen, if they know how to prevent it, okay. Otherwise they also will send team, and they are the one who is responsible to train the people involved in the surrounding areas administratives on that, okay. Bhilwadi model, anybody know what was the Bhilwadi model? In COVID, two IPS officers, sorry, IAS officers invented that to create the social distancing, okay. None of them were doctors. How they get that idea? Because they were also got trained by these GOARN policies, okay. If you are right now working in an administrative phase, suppose you are a DM or higher ups, you have to get trained on these policies, how to, or training programs, who would the, if they are the trainees, who are the trainer? These people, those who are working the GOARN, okay. What are the things? Just you have to write these, okay. These are coordinated by WHO. This is a mechanism for combating international disease outbreak. They ensure rapid deployment of technical assistance. They also contribute to long-term epidemic preparedness and capacity building. Capacity building means training. Also they set up a surveillance at national, regional, even global level. What kind of surveillance? You all know there are 7 types of surveillance, na? In AIDS, I told you. Also, if you do not remember, there is these surveillance systems are written in PARC, okay. Epidemiological, laboratory, ecological, anthropological, okay. This kind of surveillance they will produce, and also there are also 3 types surveillance which are left, and those are used for HIV. One is Sentinel. What are the other functions? They will investigate and they will create the early control measures. They will also implement the preventive measures. Preventive measures, obviously there will be a behavioral and environmental, and most of all there will be a political. If there is no political motivation is done, then that will be a catastrophic. You all know there are some, in our case, in our India, there are no political party contested the lockdown, but in other countries there was contest, oppositions, they told that there was no such thing as COVID, it's a hoax. Trump, I think himself said, na, during that time, that it's a hoax. And also famous player Novak Djokovic, tennis player, he refused to take the COVID vaccination. That is why he was banned from playing French Open and also Wimbledon on that year. That is the thing, and obviously monitoring and evaluation. IHR it will come to last later. And this is a thing, it might ask, try to remember the picture, what are the role of a national epidemic alert and response system. If the international level is GOARN, in our national we have our own, and this is their function. Okay, try to decode the picture, and if you failed to do it, then come to me. Okay, I will not explain on that. I think the class is overall is enough for you. Now this is the list, what are the emerging virus or emerging bacteria, emerging parasite, re-emerging, and for fungi also. Remember at least 2, and if it come as a short note, at least give 2 example of each. Okay.